Hey everyone, and welcome to today's lesson on dealing with aggressive and violent patients in the emergency department. Aggression and violence, unfortunately, is not uncommon in today's emergency departments. So it's our job to recognize when these situations come up and know how to deal with them. What do we consider an aggressive or violent patient? Well, aggression doesn't have to be physical. It can be in the form of disrespectful language, profanity, sexual or racial comments, inappropriate touching, outbursts of anger, throwing things, and then, of course, physical contact. And this can actually be like being struck by a patient or restrained physically. In dealing with aggression, we need to understand the basis of it. Is this a demented patient who's just cursing at us, or a mentally ill patient acting out? Or is it a family member who just maybe lost a loved one and is looking to retaliate? There are some obstacles to dealing with these patients. One of the most common among ED nurses is the thought that it's just part of the job. Now, I'm sorry, guys, but it's not. We don't have to stand for aggression, and we certainly should not accept violence. We may not have the best communication skills for dealing with these patients. Some of this just comes with experience. New grads may not have as much of the communication abilities that some of our veteran nurses do. Some of us may have that fear of reprisal. We don't think the administrators have our back. I hear that a lot. If we stand up for ourselves, will it cause more of an issue? And then there's the lack of resources. We're going to talk about a show of force. But to do this, you actually need people. Not every ED has security on staff. So the best way to avoid violence and aggression is with prevention, and it usually starts with the initial contact, creating that rapport with the patient. Use their name. We want to give generous time estimates. Always overestimate. Don't tell a patient it's going to be 10 minutes before they go to CT when you can't guarantee that. Even if you can't control the time frame, if the time frame passes, you're going to be seen as a liar. And let me tell you, losing your patient's trust is really hard to get back. If you know it takes an hour to get labs back, tell them best cases too. Never cross your arms. It kind of blocks you off and it looks aggressive. You want to establish your availability. Can anyone say call bell? When you're talking with your patient, do me a favor, pull up a chair, sit down next to them. Don't write on a pad or type in the computer when the patient's pouring their heart out. I see that a lot as we roll in and we bring that computer on wheels with us and we focus on that instead of our patient. This is something I do with my students in clinical. I never let them bring anything to write with or type with during the initial interview. Go in there, get to know your patients. And also, never forget your patients are there. I know we get busy, guys, and if they don't need anything, we tend to focus on our sicker patients rather than the ones who are stable. Time stops for patients in the ED, so 10 minutes can seem like an hour. Do me a favor, don't forget they're there. Swing by every so often just to check on them. Say, hey, how you doing? It'll go a long way. So how do we deal with the situation? Well, the thing to do most is try to de-escalate, basically talk the patient down. Now, if the patient is challenging the nurse or doctor, let them vent. You want to be empathetic to their feelings. When they tell you something, repeat it back to them so they know you're listening and understanding. And watch your body language, guys. Those closed off arms can set a lot of people off. Patients see everything. What you do is being watched by every patient in that ED. Don't forget that. Now, if a patient is non-compliant, meaning they're not doing what we're asking them to, we have to set limits. Let them know what behavior is acceptable and what's not. If there's a choice to be made, give them a time frame and establish consequences if that behavior continues. If they're having emotional issues or an emotional release, let them vent, but remove the audience. Try to get them to a private area. You'll see that a lot of times when a patient gets aggressive and that crowd builds up, it kind of fuels them. Make sure that you give them your undivided attention. Okay? We don't need the crowd, but they do need you. And don't turn your back on these patients, guys. They're emotional. And if they think that you're ignoring them, they could lash out physically. Some patients try to intimidate us. Now, if you see this happening, you need to maintain space between you and the patient, at least 2 to 3 arms lengths. All right. Keep an open stance with open hands. Closed hands kind of mean fists, and it's seen as aggressive. You need to take off anything that can be used as a weapon: pens, shears, stethoscope, lanyards, and yes, I have been choked by my own lanyard when I leaned over the patient I thought was unconscious and he grabbed it and it did not go well. Always have an exit. Try to put yourself between the patient and the door. And if you have to, call for a show of force. And this is simply a numbers game, guys. Get as many people as you can to simply stand behind you when you're interacting with the patient. Now, this can be other nurses, security, ancillary, anybody. If an aggressive individual finds that they're up against 5 or 10 people, suddenly they may not feel as intimidating. And if you see a gun, I want you to scream, "Gun, gun, gun," and get the hell out of there. You are not bulletproof. So physical violence is never acceptable, and you need to protect yourself. If you find yourself in this situation, know how to either get your team or run. It really doesn't matter why someone's hitting you. You just need to not be hit. So guys, when dealing with these patients, usually communication is the best prevention. Their outbursts or aggression are just their way of coping with the situation, and we have to do our best to kind of redirect them. And of course, our safety first, and then the safety of our patients. So a few key points. We discussed what is considered aggressive, and you need to know what is acceptable and what is not. We need to overcome the obstacles to dealing with these individuals, whether they be with the facility or with ourselves. Prevention is the best tool in dealing with aggression, but if it does escalate, we need to know how to deal with it. And if all else fails, please get the hell out of there. Thanks for joining us again today, guys, and please check out the rest of the emergency medicine series here on nrsng.com. And as always, happy nursing.